Hello. Still we are talking about the anatomy of the liver, and in this video I'm gonna talk to you about the lobes of the liver. First of all, we can divide the liver either anatomically or functionally. So I will start first of all with anatomical division of the liver. If you look to the figure here up, you will see this is anterior view for the liver, and up there is the diaphragm that's pulled up, and so you can see the falciform ligament. There is a video on falciform ligament, you can watch it if you want, but we know that the falciform ligament, the free edge of the falciform ligament contains the round ligament, and anatomically falciform ligament divides the liver into right large lobe and left small lobe. Okay, now let us now shift to the posterior inferior surface of the liver. So here we are looking to the visceral surface or posterior inferior surface of the liver. So if you look here, you will see there is a reflection for the peritoneum, right here and there. So the reflection of peritoneum, it creates a kind of fissures either here or there. Furthermore, there is grooves for even vessels or structures, like groove for inferior vena cava. This is inferior vena cava, and this is the groove of it. And there is also fossa. This is like a fossa for gallbladder. So these, reflection of peritoneum and fissure created as a result of these reflection and grooves and fosses for different structures, it create kinds of extra landmarks that divides or these structures divide, or landmarks divide, the right lobe of the liver for further lobes. Let me show you. Let me first erase these things. Okay, so this is the round ligament, and we know that the falciform ligament divides anatomically the liver into right lobe and left lobe. Okay, now also the fossa for, if you would draw a line, this is indeed called right fissure. Now let us draw the left fissure passing through the fossa for or groove for inferior vena cava and fossa for gallbladder. Okay, this is the left fissure, and this is the right fissure. Okay, and in between there is a porta hepatis. So these structures create a kind of arch shape. So this is the left fissure, this is the right fissure, and this is the transverse, you can call it transverse fissure, or porta hepatis, create this transverse plane in between. So by this division, the right lobe subdivided into, of course, right lobe and caudate lobe posteriorly and quadrate lobe anteriorly. So the caudate lobe and the quadrate lobe both are anatomically parts from right lobe, but functionally these two lobes, I mean caudate lobe and quadrate lobe, functionally are parts of left lobe. So let me summarize it to you. So the anatomically, the falciform ligament divided the liver into large right lobe and small left lobe by falciform ligament. This is anatomically. And if you look to the visual surface also, the right lobe, I'm still talking anatomically, the right lobe also subdivided by reflection of peritoneum and fissures and grooves for other structures using the H shape. This is the left fissure and right fissure that passes through the groove for inferior vena cava and fossa for gallbladder, and porta hepatis in the middle, creating H shape. So by this H shape, the right lobe further subdivided into right lobe and caudate lobe posteriorly and the quadrate lobe anteriorly. Okay, but functionally, which is more important, the caudate lobe and the quadrate lobe both are part, or they considered part of left, not right. This is what? This is functionally. Why? Okay, in the next slide where I will explain why. So let us start with the right lobe. You know, if you look to the right lobe, you will see that mainly it's located in the right hypochondrium, and it extends a little bit to the epigastric region. Now, the right lobe is the largest one, the largest lobe I mean, and let me show you this. This is the inferior vena cava, which is a large major vein in the posterior abdominal wall that returns the blood from the lower part of the body to the heart. Now, and this is, you know, the liver. The blood from the liver returned through three major veins, right? Through right hepatic vein, middle hepatic vein, and left hepatic vein. And these veins divide the liver into different sections, or many sections, which is indeed the functional division. But let us shift back to the right lobe, and you can see. Okay, you can say, okay, this is anatomically or physiologically. You know, now I will talk about the right lobe functionally. That means without the caudate and the quadrate lobes. I'm not going to talk about caudate and the quadrate because, as I mentioned, functionally this is the right lobe and this is the left lobe, because we consider caudate lobe and the quadrate lobe parts from the left lobe. So let us talk about this one functionally. So this is the right lobe, and look here, this is the right fissure that passes from the groove of inferior vena cava and the fossa for gallbladder. Let me show you back here so you will get a better idea. Okay, I think you remember this is the inferior vena cava and this is the gallbladder, and this is, I'm talking about this right fissure. So from inferior vena cava to the gallbladder, this is the right fissure. Back again here. Okay, this is the right fissure, right? So now the right fissure divided by the right hepatic vein that indeed drains the blood from the right lobe, divided the right hepatic vein divides the right lobe into anterior sections and posterior sections. It's the same color, right? Right, anterior sections and posterior sections. Okay, this is the right lobe. But take care. Here we're talking about hepatic vein, not portal vein. Portal vein, this is blue one. That, you know, this is one of the major veins that carrying blood from the gastrointestinal system to the liver, and it divided into right portal vein and left portal vein, right? So the right portal vein drains the blood to the right lobe, right? And the left portal vein drains the blood to the left lobe of the liver. And there is here caudate lobe, you know, it takes blood from both right and left. We'll talk about that. But let us focus now on right lobe that you know, receives the blood through the right portal vein, and most importantly, it drains the blood drained from the right lobe through the right hepatic vein to the inferior vena cava, right? Now, what about the left lobe? Okay, functionally, this is the left lobe. So, you know, it varies in size, and mainly it's located in the, this is the, should be here, okay, it's located mainly in the epigastric region and a little bit extend to the left hypochondrium. And if you look here, you will notice that we have left hepatic vein that drains the blood from the left lobe of the liver. But at the same time, the left hepatic vein divides the left lobe of the liver into lateral and medial segments, not anterior and posterior like the right. No, in the left hepatic vein divides the left lobe into lateral and medial segments. But in the right hepatic vein divides the right lobe into anterior and posterior. Okay, let us now shift to the caudate lobe. When you say caudate lobe, always keep in mind that we're talking about a small lobe located posteriorly, here we go, which is close to the inferior vena cava, between the inferior vena cava and the groove for ligamentum venosum. Okay, here we go. This is the caudate lobe, right? So it has two processes. One is like nipple shape called papillary process. Here is the papillary process that directed toward the porta hepatis. So this is the papillary process, and it has also caudate process, this one, that connects the caudate lobe to the right lobe, right? So, yeah, what else? The relation, yeah. So, again, for the relation of this lobe, inferiorly the porta hepatis, and if you go to the right, because this is to the right, right? So there's a groove for fossa for inferior vena cava, and to the left there is a fossa for ligamentum venosum. So, and I would say finally that the caudate lobe located posteriorly and you can see it like posterior inferiorly on the visual surface of the liver. Now, the caudate lobe, this is the segment number 1. It's located posteriorly close to the inferior vena cava. So they consider it sometimes as a third liver. Why? Because the vascularization is independent. How is it independent? Okay, I will show you. If you look, this is the right lobe, right? And this is the left lobe. And if you look to the blood vessel here, the hepatic artery proper, it divides to right hepatic artery and left hepatic artery. The right hepatic artery supply the right lobe. The left hepatic artery supplies also the left lobe. Okay, but you see here, this caudate lobe takes blood from the right hepatic artery and left hepatic artery, and also blood coming from gastrointestinal system through the portal vein. It drains to the left and drains to the right lobe of the liver, and at the same time, I will erase it so it's gonna be like clear. So let us follow the blue one. And also the caudate lobe takes blood from the left portal vein, and also from right portal vein. What else? Also, it drains bile to the right hepatic duct and left hepatic duct. So it takes the benefit from both right and left hepatic artery, bile duct, portal vein, or in general we can say the benefit from portal triad. What else? If you look to the caudate lobe, you will see that it drains its own blood through small veins to the inferior vena cava directly. You see these veins? And not through the right hepatic or middle or left hepatic vein. No, directly to the inferior vena cava. That's why they consider it sometimes as a third liver. And surgically, there is a surgical division. This segment is considered as segment number 1. We'll talk about that in another video. So finally, okay, we finished the right lobe, and we talked also about the left lobe, and we finished the posteriorly the caudate lobe. Now what else? Now we have lastly the quadriangular shape lobe, which is called quadrate lobe, right? This lobe located anteriorly, not posteriorly. We can see it on the visual surface of the liver between gallbladder and this ligament, which is the round ligament of the liver. So just keep in mind that quadrate lobe is anterior, but caudate hidden posteriorly, close to the inferior vena cava. Always posterior, always inferior vena cava posteriorly. Gallbladder always anteriorly. So quadrate lobe located anteriorly on the inferior surface of the right lobe. Right, this is anatomical division. Okay, we consider it from the right lobe. And the relation, as I mentioned, for this lobe, anteriorly is the anterior margin of the liver, and to superiorly there is a porta hepatis, to the right, we have the fossa for gallbladder, because this is the right. And to the left, we have fossa for ligamentum teres or round ligament. Ligamentum teres, it's similar, another name to the round ligament of the liver, right? There you go. Okay. Let me summarize it to you guys at the end. And so finally, I would say the liver can be divided into using falciform ligaments into right lobe and left lobe, and the right lobe can be subdivided further in using fossa for gallbladder and groove for inferior vena cava like this, and porta hepatis, into quadrate lobe and caudate lobe posteriorly. And functionally, because of, as I mentioned previously, the caudate lobe and the quadrate lobe, and caudate lobe, both are parts of left lobe functionally. Why? Because this is the left lobe, and this is quadrate lobe, and this is caudate lobe. If you look, that the left hepatic vein drains the blood from left lobe and quadrate lobe, and left hepatic artery, left portal vein, both drains or supply the blood to the quadrate and left lobes. That's why we consider quadrate mostly as a part, functionally as a part of left lobe of the liver, and caudate, mostly they consider it part of left lobe, but some authorities they said no, it's a third liver. Thank you for watching, and hope you find value in it. Thanks.